Yeah, so when we think about heart attack risk, I think it's important to recognize that about a third of us at the moment will die from a cardiovascular cause. So it's very, very common. And the second thing is that the disease, atherosclerosis, that leads to the hardening and furring up of arteries, starts in our 20s and 30s. So in other words, this is a long-term project. The third thing I would say is that there are so-called modifiable and non-modifiable risk factors. So we know that heart disease runs in families in some sense. You can't change the genes that you were born with. That's a non-modifiable risk factor. But things like smoking, blood pressure, diabetes, high cholesterol, these are all things that we can identify and modify to change long-term cardiovascular risk and outcomes. Well, again, I think that's a difficult question to answer because, you know, in general, physical exercise is good, but it depends very much on the person and their cardiac status. So for a healthy person, we generally recommend a minimum of 20 minutes of cardiovascular activity, not less than 3 times a week. But I would qualify that very heavily according to the individual's resting level of fitness and to their overall cardiovascular health. Well, heart healthy lifestyles really focus around long-term management of things that we can modify. So diet, including a low-fat, low saturated fat, low carbohydrate diet, I think is probably the best counsel in the world in which we live, with the aim of maintaining a healthy body mass, reducing the risk of high blood pressure and of diabetes. Low salt diets reduce the risk of high blood pressure. Clearly, not smoking is one of the most important aspects of healthy lifestyle to prevent long-term cardiovascular complications, and taking regular exercise. So I sometimes say to my patients that they need to think about exercise, or we need to think about exercise in the same way as we do brushing our teeth. If we don't adopt healthy lifestyle, then we will end up with weight gain, high blood pressure, high cholesterol, and so forth. If we commit to a healthy and incorporated set of life choices, then we don't remove cardiovascular risk. We can never do that entirely, but we alter the outcomes over the long term. Well, I think the lifestyle modifications in respect of diet, exercise, not smoking, and managing weight are one side of the equation, and they are very important. And they're clearly very much in the individual's domain. But in addition to that, there are some important medical considerations in adult life, and particularly from middle age onwards. And they relate to knowing and, where appropriate, managing elevated plasma cholesterol, to knowing the level of sugar in the blood, the fasting sugar, and something called the glycated hemoglobin as an indication of diabetes or diabetes risk. So there are additional possibilities to characterize cardiovascular risk in selected patients, but blood pressure and cholesterol and diabetes would be the most important things to manage. I didn't mention blood pressure in detail, but certainly knowing the blood pressure from middle life onwards is very important. High blood pressure elevation is a very important driver of cardiovascular disease. It drives heart attack risk, stroke risk, and the risk of kidney disease in later life. So very important to know and manage the blood pressure.